Hi, and thank you for the time that you're going to take to watch this video so you can learn what can be done for your chronic pain, your nerve pain, and all done naturally. Hi, I'm Dr. John Harper, DC. I practice functional medicine and functional neurology. I am a certified board member of the American Functional Neurology Institute. I have 36 years of private practice. I have personally consulted, examined, and treated over 8,500 patients. I have over 1,000 hours of postgraduate studies. My specialty is cutting edge treatments for chronic pain and nerve pain. Um, we have patients from all over the United States and Mexico come to see us. I am the co-owner of Southern California Regenerative Medical, Inc. We are an integrated medical office. What does that mean? It means that we have the best of both worlds. We have medical doctors, chiropractors, nurse practitioners, nurses, everything that we need to offer you the best opportunity to get well. I am the owner of San Diego Pain Relief Center, and personally, I have 4 kids and 6 grandkids. I am so blessed. Speaking of kids and grandkids, this is one of my lovely daughters and a couple of my wonderful grandchildren. And the reason why I'm showing this picture is just I'm very proud of it. I took this a couple Christmases ago and I just love it. The other reason is that this is my why. This is why I take care of my health. This is why I do the things I need to do to stay good, because I want to be able to enjoy their lives as much as I want to enjoy mine. And when you come to the office, we would like you to have a why. We want you to want to know why. And I know most people say, well, my why is I want the pain to go away. And that's great. And that's a wonderful why. But maybe you want to get back to golf. Maybe you want to get back to skiing. Maybe you want to get out back there to walking. Uh, Maybe your pain is keeping you from sleeping, and that causes all kinds of problems. Maybe you're having trouble being the pleasant person that you used to be because of this. Maybe your relationships are suffering. Maybe your work is suffering. Maybe your retirement is suffering. So maybe you want to go travel. Maybe you want to see things or do things you've never done before. So when you're having chronic pain or nerve pain, it sure makes it difficult to want to do these things. So let's have a good why. So what causes pain? So pain, sometimes people think it's because of genetics. Sometimes it's because they're a bad person. Karma could be the reason is that the reason why you're having pain is because there's some tissue degenerating. There is something going bad in your body that needs to be regenerated so the pain can go away. So I'm going to use the illustration of how people get nerve pain. And this will also be the same for joints and muscles and spinal problems and facial problems. All this is related in the same way, but let's specifically talk about these nerves. So as you see, this is a nerve, and this is a healthy nerve right here. It has the nerve fiber on the inside that carries the electrical impulse. This is just like a wire. This would be the metal part of the wire. Then you have the covering on the outside. This is called the myelin sheath, and this would be the rubber insulation that would be on a wire. Now, the thing that's different with a wire is that blood vessels, wires don't need nutrition, but nerves and the rest of your body does. So as you can see, with healthy nerves, you have, healthy blood supply, you have healthy nerves. Now, what can happen is that there could be some damage done to the blood vessels. This could be from blood sugar issues. It could be from inflammation. It could be some problem with the body's ability to push blood all the way through your body. But what's happening is that the blood vessels are starting to degenerate. We start to lose the myelin sheath. Now, it looks like there's something taking bites out of it, but it's not biting. It's just rotting. It's just decaying, deteriorating. If this is allowed to go on, eventually the blood supply is so bad that the myelin sheath, the insulation starts to pull away, and now you have a bare wire sitting in our salt water. So this is just like taking a live electric wire and putting it in a bucket of salt water. It's going to short out. This is where you start getting pain. This is where you start having problems. You're also going to probably experience things like tingling, numbness, burning, funny feelings, ants running around, balance problems, all kinds of things go south when you start having nerve problems. Now, hopefully you're not at this level here, because this is a dead nerve and this is something that we can't help. Now, we won't know where you are based upon your symptoms, but we will be able to, once we're talking to you, we will be able to get a good grasp if you're a good candidate to come in and at least have the initial examination. If you do have that initial examination and you are at this level, we will unfortunately have to tell you that things have gone too far, and unfortunately this is something that we can't help you with. Now, these problems are progressive and degenerative. What does that mean? Well, progressive means that the symptoms that you suffer with right now are just the tip of the iceberg. This is going to just get worse. Degenerative means it's just going to keep going. It's not going to stop. This under here iceberg is going to keep growing, and then the symptoms are going to keep growing. So very important to remember that if left untreated, pain will erode the quality of your life and it will threaten your independence. In those 8,500 patients, these are the two big concerns. I can't do the things I want to do. I can't do the fun things in life. And the other is I am stuck and I have to wait on people. I can't drive my car. I can't do things around the house. I have lost my independence. And the vast majority of people that I have come in contact with do not want that. So there's a couple different ways to take care of this problem. Typically, a physician will want to cover up the symptoms. If you're having problems with your nerves, it's going to be Neurontin, gabapentin, Lyrica. These are actually medications that are for seizures. These are not FDA approved for nerve issues or other kinds of pain. This is just for seizures. And the way it works is, as a seizure is that your brain has too much electrical activity. So these medications put your brain to sleep. Yeah, I don't know about you, but me at 62 years old, I don't need my brain any sleepier. I want it to be as sharp as possible. So also these things have 10s, 20s, gabapentin has close to 100 listed side effects, and they're not pleasant. So if you want to just cover up your symptoms and let it get worse while you think it's better, then this is the way to go. But if you want to actually really fix the problem, to reverse pain naturally, you have to increase the blood circulation. You got to decrease inflammation. And really important is you got to increase the energy inside the cell. We have to increase the energy inside the nerve cell for nerve pain. If you have other kinds of chronic pain, joint pain, spinal pain, facial pain, you need to increase the cell energy in the cell in these areas as well. And it is very important to remember, you got to treat the cause. Medication does not treat the cause of this problem. It just covers up your symptoms. It goes to your brain and it puts the part of your brain asleep that feels pain. So to treat the cause, we would understand that after that initial examination in our office. So what do we use? Well, we use what's called electric cell signaling. It is a specialized electrotherapy machine that produces different frequencies. And so it's not a TENS unit. I can buy TENS units for $25. This machine is $50,000. It's not a PEMF. It's not a HACOMED. We have used all these things in our office before until we got the electric cell signaling. What it is it's frequency medicine. The machine has over 100 frequencies in it, and after your initial examination, we will come up with a personal protocol just for you and your problem. Electric cell signaling has over 30 medically researched published studies on effectiveness and safety. Up until about, it was 3 years ago now, at the very end here of 2021, and we started doing this in our office. At that time, we did about 20 different things. 6 months after doing this treatment, we got rid of everything else except for this. This is so effective and works so well and has no side effects to it that we just went with the electric cell signaling, and we are having over 80% of our patients tell us that within 3 months of the treatment, they are having at least 75% decrease of their symptoms. That's pretty amazing statistics. So, like we said, electric cell signaling promotes vasodilation. What's that? Well, if you look here where it says typical blood flow, this is usually a blood vessel that's not very healthy. It's got lots of inflammation, might have a diabetic person with this. And so your typical blood flow is just not that much. But what happens is that the electric cell signaling creates nitric oxide, and those molecules, like this, like a fire hose, out comes the blood. It opens up the circulation. So the electric cell signaling promotes, increases blood circulation and decreases inflammation. Also, something very important and very unique to this treatment, we need to have a little physiology lesson here. So there's a thing in your body called cyclic adenosine monophosphate. So I don't trip over my tongue, I'm going to use the standard abbreviation of CAMP. And it's kind of nice because the amp is like amperage, and it reminds me that this directs all cell specific activity. So when it comes to your nerve cells, the C-amp allows the nerves to carry the impulses to where they need to be and come out correctly. In your muscles, it allows the muscles to contract and relax so you can move your muscles smoothly and with strength. If it's your stomach cells, how to digest your food and move it on down the rest of the digestive system. So C-amp is very, very important. And when we talk about electric cell signaling, the C-amp actually causes normalization, up to 5 times increase in intracellular C-amp. So if we're going to increase the C-amp 5 times, that is like your car being able to go 10 miles an hour, and then you get some kind of special super duper modification to the car, and now it can go 50 miles an hour. By doing that, you increase your intracellular C-amp. Now, this was a study done at University of Virginia by Clarence Cohn, MD, PhD, probably a pretty bright guy. So electric cell signaling increases the energy in the cell. So now we have the 3 things that we need. We need decreased inflammation, increased circulation, and increase energy in the cell. So our office uses a combination of electric cell signaling and sub-Q vitamin injections. Poor blood circulation can block the delivery of proper nutrients to the affected area. So we use sub-Q vitamin injections. What's that? Sub-Q means just underneath the skin. So we just go underneath the skin and we give you injections of B vitamins, vitamin C, trace minerals, and amino acids. And this provides the nutrients right where they need to go to replace painful tissue with healthy new tissue. So think of the electric cell signaling as the construction workers and the sub-Q vitamins as the wood and the nail. So when you put those things together, something gets built. One without the other, nothing happens. So for this treatment to work, you have to do the vitamins. Now, do you feel it? Yeah, you feel a little bit. It feels like a little bee sting. I've had numerous of these treatments, and it's helped me immensely. It is well worth it to do these little sub-Q vitamin injections. If you're sensitive, we have cold spray, numbing spray that we could use, and then it'll numb it out, and then there's no problem at all. So it's really not a big deal, and it just works so much better. So to kind of show you that we actually have caused the body to regenerate new tissue, I want to show you this is a result of a patient that had a nerve biopsy. What's that? Well, some of our patients, not very many, but some of them, we recommend a nerve biopsy where we take a little 3 millimeter piece of your skin and send it in for analysis. So this is right here from the upper thigh of one of our patients. And this brown line right here, and there's a little bit right here, that represents what the pathology lab found as far as nerves. And if you look, highly reduced small nerve fiber density consistent with small fiber neuropathy. Also, this person only had 4 millimeters. Well, you're supposed to have a lot more than that to be normal. This gentleman went through our treatments and small fiber density within normal range. And look, up to 20. He's got 20. See all these brown lines here? You can hardly move this around without running into one. This patient went from pain, tingling, numbness, balance, following, weak muscles, cramps, pretty much had everything. After 3 months of treatment, he said over 90% of his symptoms gone. Pretty amazing. Pretty amazing. So here we have proof that this literally regenerates the damaged tissue. Well, by now, you probably wonder what your part is as far as the treatment. And I can venture to say that most of you probably have already mastered your responsibility. You sit in a reclining chair. And how does this feel? Well, it's very comfortable. EC Stim feels good. I've had this many times. It feels like an electric massage to feel those frequencies moving into you. It's very comfortable, feels good. And it's 45 minutes in and out the door. You no need to do anything special coming or going. The treatment itself is about 20 minutes to 30 minutes, depending on what frequencies Brian has done to choose for your specific treatment protocol. Now, what's the next step? Well, schedule your screening call. And if you've already done that, keep that appointment. This is very important. It's your health, the most important thing there is. And we got to do everything we can to get you as healthy as possible. And why are we doing this screening call with me? Well, we must make sure that you have a condition that we will have success with and that your condition has not progressed beyond the normal limits of the EC Stim treatment. Very important not to waste anybody's time, not your time, not our time. We're a busy office, but we want to do our very best to help everybody. So we only take on the people that we know that we can help. And what will be going on with that first initial examination? Well, you'll meet with our nurse practitioner, Brian, and Brian is quite the wizard at coming up with the underlying cause of your problem, a personalized treatment protocol. Real bright, caring guy. Can't do any better than Brian. He'll be having a consultation with you to get to know your problem better, make sure there's nothing that keeps you from receiving the EC Stim treatment. Then there's an exam to determine the extent of the damage, and we must make sure that it hasn't gone too far and that we can still help you. We don't want to waste your time. And in addition to that, you'll have a very exciting piece of equipment testing called the TM Flow. And this checks nerve and circulation evaluation using numerous factors, including, believe it or not, quantum physics to determine your underlying problem and the cause of the symptoms. It used to be very common with a lot of these kind of problems that there was these nerve tests where there was needles put in your back or your neck, and then there were other needles put down in your hands or in your feet, and somebody would run electricity through that to try and test your nerves. Very painful test, not very accurate. The TM Flow, this technology has replaced all that. This is now the gold standard for these kind of tests. And this is what it looks like. You lie down. If you can't lie flat, we'll have you sit up or we'll put a pillow or something underneath your knees. And it has 4 blood pressure cuffs. And this picture doesn't show the little sticky pads with the wires that go on the bottom of your feet. Again, this is another test that we can do in our office. Very easy. And once it's done, it'll do 2 things. It'll first of all tell us if you've gone too far. And hopefully that won't be the case. And what we'll be able to do with this is to be able to zero in more on your problem, your issue, and to make sure that this is something we can help you out with. So after that initial examination, if you have the kind of problem that responds to the EC treatment, you will be accepted as a patient and you will sit down with your case manager. This is somebody who knows you, who's going to know you by name and by face and be able to talk to you anytime that you need to meet up with them. And that day, the case manager will go over your office visit schedule for your best results and talk about any other tests that Brian has recommended to perform, as well as any other kind of follow-up testing. Maybe there's a possibility of some other types of care to speed the healing. Maybe you'll
get back with your own physician or maybe somebody else. We just want to make sure we're doing everything in our power to get you better as soon as possible. And the case manager will go over the fees in writing with you, and we promise there will be no misunderstandings here. I would never put a patient or a staff member in the uncomfortable position of, I didn't know about that. Anytime we talk about schedule and money, it's always in writing, and you will read it and sign it. So the EC STEM fees, the initial examination is $150. That'll include your consultation, your exam, and your TM flow test and the results of all that and the report there. The treatments are $200 each. Patients are averaging 24 treatments. So to save you breaking out the calculator, if you do the exam and that and 24 treatments, it's $49.50 is the total fee for all the treatments. We have monthly payment programs, and if you pay earlier on time, you get a little bit of discount. If you decide during the treatment you're not going to continue, then you would get refunded for any things that you haven't received yet. And unfortunate note, insurance carriers have decided to not cover these services. I'm not quite sure. Coming up on 38 years in practice, and it just seems like it goes backwards a bit of the time. Here's something that has no side effects, is not very expensive in comparison to a bunch of other things that they're paying for, and great results. And you do it once and it's over. But for some reason, they just decided that this was something that they're not going to cover.
So expectations, very important. People have had problems for months, maybe years or decades, and they want the pain to go away in 2 visits. And that's just not going to happen. So be clear, unreasonable expectations are the kind of things that'll ruin your care with EC stim treatment. This is not a quick fix. You're not going to walk out of the office saying, oh, wow, that sure feels a lot better. It takes at least 3 months to grow back new tissue. You can't expect symptomatic changes until then. So we want to fix your problem once and for all. We're not trying to just cover up your symptoms temporarily so it can get worse on its own. So please be patient. We will be doing re-exams every month to make sure that we are charting your progress. And even though you may not feel any symptomatic changes, we will definitely see changes in the exam, and we'll share that with you. Your number of treatment and frequency of care will be discussed with the nurse practitioner. On average, and I underline that because it's just an average, patients come in twice a week, and it's for 12 weeks, so a total of 24 visits. That again is an average. Some are more, some are less, but I wanted to be able to give you a heads up and so you can plan appropriately. Keep your scheduled appointments. This is like building a brick wall. Every time you miss, we've missed the opportunity to place a brick on the wall. So please keep your appointments so we can keep the progress going. There will be monthly re-exams, like I said, to chart your progress. And then the good news is once you get through with the treatment, you don't have to do any more treatments. There's no maintenance. You don't have to keep coming in. You don't have to do anything. It is a one and done after the required treatments. No maintenance treatments are necessary. Most people just love that. No pills, no shots, nothing you got to do in the future. So let's have a little word about respect. Our office has put aside 20 minutes of my time just for you and for that screening call. And if you feel that we're not a match in your mind, please show us the respect we deserve. Give us a 24-hour notice to cancel our screening call so someone else in pain can talk to me. If you need to reschedule, call us at 858-397-2511 ASAP. We will do our best to accommodate you. To make it clear, if we were coming to your house and you made plans for us, you would certainly want to know if plans have changed. So if you change the plans on us, please let us know. Have the same respect for us. Thank you. Thank you very much for the time that you have taken to watch this. I look forward to having our 20-minute screening call to make sure that you are a great candidate for what we offer in our office and to make sure that EC STEM is the right thing for you to do. And my final thought for you today is I sure hope this is something we can help you out with. And if it's not, I will do my very best to see and find somebody else who can. Take care now.